Good morning, everybody, and welcome. We are very pleased this morning that Art Babcock will be talking to us about the Sanofi survey today. Art is a well-known industry author, speaker, and educator, so there's actually nobody better to go through this information with us, so we are so excited about that. Art has been on the Sanofi Canada Healthcare Survey Advisory Board for the last 14 years, so again, one more time, we're very excited to have him here. And thank you, Art. And I'll just turn it over to you.
Thanks, Del. Appreciate that. Okay, good morning, everyone. It's my pleasure to be here with you today to talk about the 2018 Sanofi Canada Healthcare Survey. And the theme this year was connecting the dots. And as we go through, we'll hopefully join some thoughts and some actions with respect to the findings. The agenda today includes some survey background, a nod to the advisory board, a look at health plan value and design, observations on health and chronic disease, where we are at with wellness, suggestions for leading practices, which we used to call best practices, and questions, time permitting. The Sanofi Canada Healthcare Survey is the Canadian benchmark for plan member and plan sponsor perception of health benefit plans. And since its inception in 1997, the survey has gathered the opinions of more than 32,000 plan members, and from 2012, the opinions of about 2,700 plan sponsors. In January of 2018, a nationwide online survey was conducted. Responses were received from 1,503 plan members and 502 plan sponsors. The average age of respondents was 47. There was almost an even split between male and female, and the average household income was just over $81,000. 50% of plan sponsors employed less than 250 people, and a third indicated that their workforce included unionized members. Our advisory board included 21 experienced professionals representing plan sponsors, advisors, and insurers, and we're all very thankful for thumbnail pictures and Photoshop. We're going to start by looking at some of the results that address plan members' perceptions of value when it comes to health benefit plans. To set the stage with this, we've included the following quote by one of our advisory board members, Chris Bonet of H3 Consulting. Chris says that on one hand, these results demonstrate how a supportive work environment can create visibility and appreciation for high-quality benefits. On the other hand, we see that people in poor health continue to be the least satisfied with the value of their plan. We may be losing sight of their experiences because they're lost in the majority of people who are relatively healthy. The good news is that Canadian plan members appear to be more positive about the quality of their health benefit plan. As the dashed line indicates, 58% describe it as excellent or very good, and this is up from 48% a year ago and closer to the results that we've seen in previous years. As well, 62% say their plan meets their needs extremely or very well, as shown by the solid line. This is an improvement over the last 2 years when the result was in the low to mid-50s. When we dig deeper into the data, a handful of variables clearly influence the results as they have done consistently year after year. For example, 72% of plan members working for employers that offer wellness programs say that their benefit plan meets their needs extremely or very well, compared to 54% among those who don't have access to workplace wellness programs. Similarly, plan members are far more likely to be positive if they have health spending accounts or say they're satisfied with their current job. On the other hand, we also see that plan members who you'd think would be most in need of health benefit plans are much likely to say that it meets their needs extremely or very well. For instance, only 50% of plan members in poor health gave their plan top marks for meeting their needs, well below the 77% among those in very good or excellent health. And you can see similar results based on household income. Connecting the dots here indicates that today's plans are valued less by those who need them most, which suggests that a need to reassess traditional health benefit plans from the perspective of plan members in the greatest need. Considering value from a broader perspective, let's start with this comment from Advisory Board member Pierre Marion from Medavie Blue Cross. Pierre states, "It's important that we look at improving how we support plan sponsors to communicate the value of their plans to their members. We can separate out the value of the insurance aspect so that it's better understood and appreciated by more than just the small number of plan members who make insurance claims." We've asked this question, what plan members value most about their health benefit plan, either coverage for regular or routine healthcare costs or insurance for unexpected, possibly high healthcare costs. We've asked this question in a variety of ways for more than 10 years. This year we changed it up a little bit by using the word insurance to help differentiate between coverage for routine costs versus coverage that acts more like insurance for unexpected and possibly high costs. Every year, though, we see the results are essentially the same. Plan members clearly value their benefit plan mostly for the regular or routine healthcare costs rather than as insurance for unexpected high costs. And these results align well with what plan sponsors would like their employees to value most about their health benefit plans. However, we also know that the drug plan, the most utilized and most valued benefit for employees, has taken on much more of an insurance role over the past few years for a small percentage of claimants who need specialty drugs. So this year's survey asked a couple of questions to try to get a plan member's understanding of this potential insurance role for their drug plan. For example, plan members are not necessarily confident that their plan would cover higher cost specialty drugs. As the slide shows, the higher the cost of the drug, the lower the confidence level. This year, we also asked plan members to estimate what their drug plan spends for themselves and their families. 10% estimate expenditures of more than $5,000, and that's an amount that's moving us out of the territory of routine and regular healthcare costs and into more of the insurance territory. 3% estimate their drug plan paid $15,000 or more, which definitely speaks to the drug plan's role as a source of insurance. What can we draw from this? On one hand, members' preference for the value of benefits to help cover routine or regular healthcare costs aligns with plan sponsors' efforts to position benefits as part of compensation, which in turn helps attract and retain employees. However, as more high-cost specialty drugs become available and as small but likely increasing numbers of plan members become aware of their drug plan's coverage for these medications, we wonder if the value conversation can be expanded to communicate the drug plan's growing role as a source of insurance for plan members in greatest need. Currently, most plan members appear to be unaware of this possible role for their drug plan. One of our other board members, Adrian Ibrahimi, suggested that communicating benefits through just-in-time methods, mobile apps for example, would be more effective in helping employees remember and understand their programs. I would tend to agree when you think about an employee booklet or a mobile app, which might be more effective. Before we get into the communication side of things, however, let's look at the plan members' use of the three main benefits. As expected, there's high utilization of the drug plan and the dental plan, both used by 85% of surveyed plan members. Just over half, meanwhile, claimed for paramedical services in the past year. We found this interesting because people who made the claims for paramedicals submitted 8.1 claims on the average, and this is not far behind the 9.4 claims submitted by those using the drug plan. I'm guessing that massage claims represented a material portion of that 8.1 claims average. Are these numbers a sign that health management prevents costs in other areas, or do they signal inappropriate use or perhaps an indication of fraud? The answer is likely a combination of all three, reinforcing the need for deeper analysis of claims. Okay, moving on into the area of communications. As this slide shows, both plan members and plan sponsors are generally positive about employers' efforts to communicate what is and what is not covered by their health benefit plans. However, far fewer plan members, about 21%, say their employer does a very good job. And this is down from 41% when this question was first asked in 2007. So on the surface, it looks mostly good, but these results generated a lot of discussion among the advisory board members, along the lines of plan members and plan sponsors not really knowing what they don't know. As noted in the full report, the main points of the discussion could be boiled down to the following connections and actions. Beyond the what and the why, when is also increasingly important. Today's technologies, along with members' expectations, have set a new bar for just-in-time information at the time of need, and here using mobile apps, on-demand videos, online chats, and virtual assistants. Speaking of timeliness, this year's survey touched on medical cannabis by asking both plan members and plan sponsors whether they agreed it should be covered by their health benefit. A good majority of plan members agree at 64%, and this increases to 72% among members aged 18 to 34. Who would have guessed that? Plan sponsors, meanwhile, are pretty evenly divided, with about a third saying they would like it covered, a third saying no thanks, and a third indicating they don't know or aren't sure. Note as well that for the 34% who would like it covered, 8% already do cover medical cannabis. And just as an aside as well, one of my largest clients has just put the coverage for medical cannabis into their program. So that's an indication from our book of business that this is going to be a trend. So the main connection and action to draw from these thoughts would be that as the number of Canadians using medical cannabis grows, requests for coverage will also grow. Plan sponsors can proactively work with their benefit providers to determine if they will cover this product with regard to specific conditions and, of course, based on clinical evidence. Paul Allen of Morneau-Shepell has indicated with respect to plan design, we'll never get to the level and reach our objectives for a healthy workplace culture and healthier employees if we can't be more precise in terms of the things that we actually need to do. The only thing that's going to get us there is data. We need to use the data more responsibly and more precisely to drive understanding and action. Plan sponsors do not seem that worried about their health benefit plans. This caused concern among members of the advisory board when we consider trends in utilization and population health. A third of respondents said they had no major concerns, which was higher than we expected. And we see that this climbs to almost half for small employers, that's those under 50 lives, and that would be 48% compared to 22% among larger employers, and that's employers with over 499 employees. As per the previous slide, plan sponsors are most likely to state they have no major concerns about their health benefit plan, although virtually the same number stated they are concerned about the sustainability of their drug plan, and this is in line with our expectations. Still, it was somewhat surprising that concerns about the drug plan sustainability did not come out well ahead of no concerns whatsoever. This may indicate that plan sponsors are not seeing the double-digit increases in drug plan costs and have concerns in other areas such as dental plans and levels of disability, as reflected on this particular slide. It's also interesting to note that plan sponsors who get claims data analysis to help identify the top disease states are more concerned about their drug plan at 39% than those who don't get these types of analysis at 25%. This suggests that the latter group may be less informed about existing pressures on their drug plan. These thoughts led to quite a bit of discussion at the advisory board meeting as we debated whether or not these results indicated a fundamental and perhaps detrimental lack of awareness or understanding among plan sponsors regarding the challenges of the market, or perhaps plan sponsors simply have bigger priorities outside of benefit plans. What led us to lean toward a general lack of awareness, however, is the particular cross-tabulation of the results that you see on this slide. When plan sponsors get claims data analysis that identify their top disease states, 39% are concerned about the sustainability of their drug plan, and this is well ahead of the 25% who are concerned among those who do not get this type of information. This suggested to us the need for better education of plan sponsors, and more importantly, the need to have a better picture of all of the cost drivers in their health benefit plan. There is a growing need for integrated, easy to understand, and actionable data from providers so that plan sponsors are better educated about plan design and the cost drivers across all benefits, not just the drug plan. This may, in turn, reduce the risk of decisions that lead to unintended negative consequences on employee health. Let's move on to our discussion of health and chronic disease. One of our board members, Dr. Alan Sato, believes the important thing to remember is that workers are hungry for personal health information and want to ask questions, and they're open to doing that with healthcare experts who aren't their family doctors, like with nurses and pharmacists. For some years now, we've asked plan members about their level of interest in one-on-one health risk screenings to determine personal risk levels for certain diseases. We wanted to get a better understanding about where members would like to get those services. So this year we started by establishing levels of interest in such services outside the doctor's office and delivered by healthcare professionals other than family physicians. As in previous years with similar questions, plan members are definitely interested in these services and are willing to get them from healthcare professionals such as nurses or pharmacists. Just over half of plan sponsors are also interested, although just 2% indicates that they're currently doing so. Then when we ask plan members whether they'd prefer these services at work, during work hours, or outside of work, and if you were an audience in front of me and asked you by a show of hands, how many of you think that plan members would prefer screening services at work and during work hours? However, I can't see you, so I don't know who's raising your hands. So anyway, the survey said that 67% of plan members indicated outside of work and 42% indicated at work and during work hours. Not only do plan members prefer these services outside of work rather than at work, but it's especially important to note that plan members who are most likely in need of these services, such as those in poor health or those aged 55 to 64, when the prevalence of chronic disease is higher, are least likely to prefer them at work. This could reflect greater concerns over privacy as well as existing relationships with healthcare professionals, and those could be factors that outweigh the convenience of getting these services at the workplace. In case you're wondering why the percentages add up to more than 100%, a handful of our respondents chose both options. Understanding this, employers can promote and facilitate access at times and locations that are convenient to employees. Utilization can be further supported by subsidizing screening that's not paid for through provincial health care. Moving on to personal health. This slide tells us that almost half of plan members consider their health to be excellent or very good. What's worth highlighting here is that this drops to just 22% among those who describe their financial health as poor. And this leads us to a quick connection and action thought. Considering the connection between physical and financial health, employers could offer programs that support and promote personal financial planning. Over the years, the survey has asked plan members about personal stress in a number of different ways. And this year's approach once again indicates disconcertingly high levels. 33% say they've experienced high levels of stress on a typical day over the past 3 months. And this shoots up to 50% among those in poor financial health, 46% among those in poor physical health, and 44% among those who are not satisfied with their current jobs. About 1 in 4 plan members report taking time off or leaving work early due to stress in the past year. The survey then asked how often they did this, and we were somewhat shocked by the average of 13.8 times. When you look at the highs and lows table, we suspect that poor financial health is a major factor in these high rates of absenteeism. Members in poor financial health took time off or left work 34.7 times in the past year, compared to just 6.5 times among those in excellent or very good financial health. What are the top sources of stress? Not surprisingly, personal finances sit at the top, but it's a virtual tie with the plan members' workload, and work-life balance is not far behind. With all this in mind, we offer the following connections and actions. Look at workloads and their impact on work-life balance. Providing access to financial planning services may help relieve a major stressor and would certainly be valued by employees. Board member Talina Orson from Suncor made the following observation regarding data and chronic disease. Benefit providers can bring the data analysis to life by linking benefit program recommendations for chronic illnesses to business drivers such as workplace safety. Employers will sit up when providers make improving an employee well-being part of an overall approach to risk management. Year after year, we found that plan sponsors underestimate the level of chronic disease in their workforce. 58% of plan members say they've been diagnosed with at least one chronic condition, increasing to 67% among members aged 55 to 64. Yet, plan sponsors estimate that just 29% of their workforce have one or more chronic conditions. Well, this gap can be due to the fact that plan members likely take steps to ensure their conditions are not visible in the workplace. The bigger concern is that plan sponsors simply do not have the information they need to properly understand the significant impact that poorly managed chronic disease can have on employee productivity and safety, not to mention the dollar impact on prescription drug plans. This is a significant issue that can impact considerably the sustainability of a drug plan. And this slide tells us that more plan sponsors and their providers need to step up to address the gap in awareness and in turn become more likely to take actions to reduce the impact of poorly managed chronic disease. This concern is heightened when we look at the results on this slide. Just 19% of plan sponsors indicate they regularly get reporting on their top disease states. When we added the 37% who get this information occasionally or when requested, and the 2% who pull it themselves from carriers' online system, we're looking at 58% of plan sponsors getting this information. results that have not changed for a number of years, despite providers' efforts to make this data more readily available. Advisors and plan sponsors on the advisory board also stress the need to reduce the complexity of information. Rather than lengthy reports, plan sponsors are looking for one-page summaries that highlight one or two action steps that will have the greatest positive impact. One more thing to highlight on this slide when we look at the highs and lows table. Plan sponsors who receive claims data analysis regarding the top disease states in their workforce are much more likely to have specific objectives for the plan. 65% say they do, compared to just 37% who do not receive these analyses. You'll find a number of connections and actions in the full report, and we highlight two here. Better analytics and data interpretation are needed to understand and act with regard to workforce disease states. A priority is to make connections between buckets of data, for example, between drug plans, employee assistance plans, and disability insurance, and to forecast the impact of possible courses of action or inaction. This year's survey also asked plan members with chronic conditions whether their conditions have affected their performance, and 47% indicated they have missed work or found it harder to do their jobs. This is up from 38% in 2016 when the survey first asked this question. Could this be a wake-up call? Are plan members struggling more with their conditions? Mental illness warrants special attention, as 72% of members with a mental health condition such as depression or anxiety report they have missed work or found it harder to do their jobs. The work performance of employees with a chronic condition is most likely negatively affected due to tiredness or fatigue at 58%, difficulty concentrating at 41%, and time off for healthcare appointments, 39%. This brings us to our call connections and actions for this section of the survey. To deal with the higher risk of presenteeism among those with chronic conditions, a greater sense of urgency needs to be attached to the impact of unmanaged chronic disease on productivity and, by extension, profitability. So what can we do to support plan members with chronic disease? The following slides indicate high levels of interest from both plan sponsors and members, as does this comment from Susan Belmore-Vermes of the Health Association of Nova Scotia. Plan sponsors are asking for help. We know that poorly managed chronic disease is a problem, and we're realizing that we need to find money in non-specialty drug spending to help afford these specialty drugs. We need better reporting and focused chronic disease management offerings that help us that allow us to help our employees. This slide highlights some results that show both plan sponsors and plan members have an appetite for more support for chronic disease management. 84% of plan members with chronic diseases would like more information about their condition and how to treat it. 79% of plan sponsors would like their health benefit plan to better support members with chronic disease, and 77% of plan sponsors are concerned about the impact of chronic disease on productivity. Now let's focus on a targeted population of plan members, those with chronic conditions taking 3 or more medications on a regular basis, and who are, therefore, among the most frequent claimants for prescription drugs. 37% of plan members with chronic conditions take 3 or more medications, and 75% of them are interested in coaching from a pharmacist to learn more about their medications and their conditions if this service was available as a benefit in their health benefit plan. Similarly, 68% of plan sponsors are interested in including such a service in their health benefit plan. And this brings us to our next connections and actions idea. A clear majority of plan sponsors and plan members would like to do more in the area of chronic disease management, which carries over into higher levels of interest in benefits in the areas of medication management and disease education. And that leads us to a comment from Advisory Board member Rachel Huckle of Shoppers Drug Mart. Plan members living with a chronic disease see their pharmacist regularly for prescription refills. Now that pharmacists can do more under an expanded scope of practice, we have a real opportunity to improve population health. One final note regarding chronic disease management. 66% of plan members indicate they would consent to receiving targeted health-related information from insurance carriers based on their personal use of benefits. Plan sponsors are aligned, with 64% indicating they're interested in having their benefit providers offer targeted communications or services to employees based on claims utilization. This helps set the stage for supporting plan members with taking medications for chronic disease, as summarized on the next slide. Data privacy is still a concern for plan members, but many have also begun to see the value of appropriate targeted communications. Advisory Board member Bard Martinez of Great West Life summarizes our connections and actions with her comments. 5 years ago, when we talked to clients about targeting members with personal health information, the answer was a flat-out no. That's changing, and insurers are ramping up the technology to make targeted communications a part of chronic disease management support. So what's happening with wellness? Jennifer Elia from Sun Life says, we are encouraging some plan members to hold off on implementing more wellness tactics so they can take the time to determine objectives and assess their foundation in terms of culture and leadership. It can be worthwhile to hit the pause button on some activities and to shift to more of an internal focus. Here we see that for the second time since asking plan sponsors in 2012, there is a significant decline in the number offering workplace wellness programs. It should be noted that the wording in this question changed in 2016, broadening the definition of wellness programs. Yet even so, the number did not increase by much, and this year, as noted, we see a material drop in results. Whether it's the start of a downward trend or an indication that wellness offerings have plateaued, the result is a concern since the survey responses from plan members tell us they are much more likely to be positive about their health benefit plan and report that it meets their needs when wellness programs are available. Survey results indicate a solid majority of both plan members and plan sponsors report that the corporate culture of their organization encourages health and wellness. 71% of plan members agree with this statement, up from 53% a year ago, and 79% of plan sponsors agree, up from 66%. What's encouraging to note is that the presence of a wellness culture is as powerful as wellness programs in influencing plan members' perceptions of their health benefit plan. As shown in the highs and lows table, 65% of plan members with a wellness culture describe the quality of their plan as excellent or very good, compared to just 38% among those without a wellness culture. Similarly, 70% with a wellness culture say their plan meets their needs extremely well or very well versus just 42% without the wellness culture. As well, 89% of members with a wellness culture report being satisfied with their current jobs, compared to just 59% among those without a wellness culture. What do we mean by a wellness culture? At this point, the concept is self-defined by respondents. But in light of these survey results, it's clearly something we feel is worth exploring in greater detail in future surveys. What about future plans? 51% of all plan sponsors indicate they plan to invest in more health education and/or wellness programs within the next year. This is up from 31% last year and a return to the 51% reported back in 2012. When we look at the highs and lows, we see that plan sponsors with wellness programs are far more likely to invest than those without wellness programs, at 64% versus 39%. This could reflect that employers with wellness programs see their value and are committed to building upon them. It's also worth noting that plan sponsors who receive claims data analysis regarding their top disease states are also far more likely to invest in health education and/or wellness than those without such analysis, with results of 65% versus 32%. Among the 49% who do not plan to invest more in health education and wellness, when asked why not, they are most likely to indicate they cannot afford to do so, although they would like to. 38% are in that particular category. With all this in mind, we offer the following connections and actions. Despite the declining wellness program numbers, it appears that workplace culture can support personal wellness, whether or not wellness programs are offered. And I think that's a very interesting thought. The survey asked plan sponsors with wellness programs to describe how they allocate their resources between four main areas of wellness. As you can see, resources are pretty evenly divided between the management and prevention of illness, emotional or mental health, physical fitness, and financial well-being. The survey asked plan sponsors with wellness programs if they provided mental health training for management. As the slide shows, about half do. When you bring employers that don't offer wellness programs, that result drops to 28% overall. We also see here that larger employers and employers with unionized workforces are far more likely to provide mental health training to management. This leads us to the following connection and actions drawn from the report. Considering the impact that mental illness can have on work performance, mental health training should be more widespread. However, efforts to support mental health should not come at the expense of efforts to support chronic disease management, physical fitness, and personal financial health. A balanced approach is required. We'll begin the leading practices discussion with a quote from Mark Bertassoni from Desjardins. Having an objective makes a big difference. One of the most important things for carriers and advisors to do is to help plan sponsors clearly define their objectives so they will see even better results from their benefit plan, results that have a direct impact on the success of the business. For the first time this year, the survey asked plan sponsors if they have specific objectives for their health benefit plan in 2018. What we see here is that just over half, 56% of plan sponsors, report having one or more specific objectives for their health benefit plan in 2018. During the advisory board meeting, we were initially surprised to see that this result was so high, based on our anecdotal experience. When we look at the highs and lows, you'll see that employers who receive disease state analysis are more likely to have specific objectives than those who do not receive analysis, at 66% and 42% respectively. Those with wellness programs and larger employers are also more likely to have specific objectives. Let's look at this a little closer. What makes this having objectives a leading practice? The slide here illustrates how plan sponsors with objectives are more likely to be engaged in the management of their health benefit plan, satisfied with its quality, and committed to employee health. We see that 69% of employers with objectives describe the quality of their plan as excellent or very good, compared to just 46% among employers without objectives. And 69% of those with objectives believe their plan contributes to a productive workforce versus just 39% among those without objectives. 68% of those with objectives get reporting on their top disease state values versus 44% without objectives. 89% of employers with objectives would like their plan to do more to support chronic disease management, compared to 66% among employers without objectives. And lastly, 68% of plan sponsors with plan objectives will invest more in health education and wellness versus just 30% among those without plan objectives. All of these results illustrate the potential power of objectives, and as Mark's quote indicated, it's a clear call to action for benefit providers and advisors to help plan sponsors define their objectives. So what are the specific objectives? This was an open-ended question. We wanted plan sponsors to describe their objectives in their own words without guidance. And as it turned out, they were not very specific. We see the number one objective for plan sponsors was to manage the cost of the benefits themselves. However, there were relatively few mentions of strategic objectives such as reducing absenteeism or improving the health of employees. And while the number two objective, to improve or increase coverage, is a positive sign, there was very little in the way of actual specifics when we scroll through the responses. Nonetheless, the presence of any objective, even if it appears to be non-specific or non-strategic at first look, is a clear indicator of plan sponsors who are more knowledgeable and more positive about their health benefit plans and are more likely involved in supporting employees' health. The connections and actions for this part of the survey are insurers and advisors can help plan sponsors define health plan objectives, and for their part, plan sponsors can seek out benefit providers with an established process for setting down a documented philosophy or long-term mission for the health benefit plan, one that ties into the overall philosophy for their business. From there, set specific short and long-term objectives that are strategic, measurable, and linked to business. This year's report concludes with a one-page wrap-up of the top 10 calls to action, which we hope you can use as an educational tool to help guide in decision-making. Here are the first three calls to action. You'll find more detail in the full report, but essentially we've attempted to boil down the primary actions or changes in approach that plan sponsors and their providers can work toward. Number one, have a big picture business context. Approach health benefits as an investment, not a cost. Number two, ensure that culture comes first. Start with a wellness culture before considering changes to health benefits or implementing wellness programs. Third, think about plan design. Carve out time outside of the annual renewals to learn enough about the health benefit plans and how they work and how you can make them better. These bullet points capture the essence of the other 7 call to action items. It's time to communicate the health and benefit plan's growing role as a source of insurance, thinking especially about the drug plan. There's a growing need for integrated, actionable data so that more plan sponsors become engaged in their health benefit plans. Canadian employers continue to underestimate the proportion of their workforce with a chronic condition and its impact. Both plan sponsors and plan members would like to do more in the area of chronic disease management. Both plan sponsors and plan members are open to targeted communications from insurance carriers based on personal claims data. Wellness programs and or a wellness culture can positively influence job satisfaction and plan members' views of their benefit plan. Benefit providers can help more plan sponsors define objectives for their health benefit plans and tie these to business objectives. Again, have a look at the full report, if you will, on the Sanofi Aventis website. Gives you more detail than what we could have covered today, and it's a great source of information for your benefit programs. So, if there are any questions, thoughts, or comments, I'd be happy to discuss.
Art, it's Del. While somebody's trying to maybe put their questions together, I find it interesting that the shift has been from cost containment to trying to do something more on a population health basis. And not saying that all employers are there, but certainly that seems to be the shift in the thinking, whereas before it was always cost containment, and I'm sure you remember that as well.
Certainly.
Yeah, and the other thing I find interesting is that the targeted communications that you were talking about from insurers, and again, I'm speaking probably from the healthcare industry, and certainly how we look at it here as the HBTA plan administrator, is that everyone is so sensitive about privacy issues that sometimes we overlook some of the benefit that some of this type of communication can result in. And so it's interesting that there's a bit of a shift there as well, because we always are so focused on privacy and you can't do this, you can't do that. So I think that was kind of encouraging, actually.
Yeah, I agree 100%. I've seen this evolve over the last number of surveys, and as Barb had commented in the one slide, it was just totally not acceptable to look at this information a number of years ago. And now both employers and employees seem to be coming around to the idea that, yeah, let's do it in an appropriate manner, and we think it can help us. So yeah, I find that very encouraging.
Yeah, and in healthcare, I'm sorry, I'll be quiet here. And in healthcare, because we're so highly unionized, we're extra sensitive. But I think, we've got, we can start some dialogue with the unions as well to get them more comfortable with some of that stuff. And I think, technology has also enabled some of that to be less invasive, maybe. So the timing is good, I think, based on those that, for employers or even the HBTA to sort of maybe look at some of that.
Yeah, I think too that if you do have any opportunity to interact with unions or do employee surveys, it might be a good bit of information to have those discussions and ask those questions to see how your employee population feels about it.
Yeah, exactly. Are there any other questions for Art? Certainly lots of food for thought. I've kind of looked at it, but walking through that was very, very useful.
Well, it was my pleasure to go through this with you, and if you have any questions that come up later on, please feel free to reach out to me, and I'd be happy to chat with you about them.
Perfect. Thank you very much, Art.
My pleasure. Thank you.
Take care, everybody.